The benefits of foam rolling include increasing range of motion, improving blood flow, body temperature, all to prepare the runner physiologically for the run ahead of them. Let's start with the hip flexors and the quadricep muscle group. I'm going to have Karen lay on top of the foam roller on her elbows in front of her. And the basic premise is to start higher up on the muscle and work down lower. So spend a few seconds top part, then move down, spend a few seconds, and continue to move down the muscle group. And you should be able to go through the muscle group about 3 to 5 times within a minute time. So keep moving down a little bit. There you go. And work on that area. And if you find any tender areas, try to stay on those for a little bit to work those out. And you can also kind of twist in or out to get different portions of the quadricep muscle. So try to twist a little bit to the inside. Good. So now we're getting the outer part of the right quadriceps and more the inner part of the left quadriceps. If you want to increase intensity, you could also move to the outside of the foam roller and do one at a time. Okay, so here we're focusing on one leg. We can do this to increase the intensity. Again, the hip flexors a little bit higher up than the quadriceps going down to the knee. You can see Karen here, she's intermittently putting her toe down on the ground for balance. She's got some weight through her elbows, but most of the weight should be concentrated on the leg through the foam roller. Now, when you're doing this, you want to make sure you're not on any bony prominences, so make sure you're below the hip bone, and you can go all the way to right above the knee while you're doing this. Again, if you're feeling any sharp pain, make sure you contact your physician or physical therapist. It should be mildly uncomfortable. That will get better the more you do it. And again, we're going to do this 1 to 5 minutes. Start off with 1 minute. If you're new to it and you're working in sections, so we start higher up and then we work down in sections, and you should be able to go through the muscle about 3 to 5 times. Okay, good. So the next one, Karen, let's do is flip over on your right side. Let's do the IT band. Now the IT band kind of starts at the top of the hip, goes all the way down to below the knee. And cross your left foot up and make it flat on there and go on your right elbow. So you can see the only contact points here are the right foot and the 2 hands. While she's doing this, she's, again, starting up higher, working in sections, going down the thigh as she's doing this, working in sections. Again, you have a hip bone right on the side there. You don't want to roll over that. You want to make sure you're below that. That'll be painful even if you don't have any hip problems. These are generally safe for most people, even if you do have knee pain. But again, if you are experiencing pain, I would recommend that you see your physician or physical therapist. The next muscle group we're going to focus on is the hamstring muscle group. That's a group of 3 muscles in the back of the thigh that goes from just underneath the buttock all the way to below the knee. And the way we're going to do this is we're going to have Karen bridge up. She's already in the position. Right foot cross over the left foot and just start rolling right below that bone in the buttock. You don't want to be on top of the bone. That can be uncomfortable. You have important structures there that can be pain generating. If you have any shoulder pain with this, make sure you stop and consult your healthcare practitioner. And as we do this, we're going to work our way down in sections of the muscle. So we start near the top part, work our way down. And again, we're going to do this about 3 to 5 times over the course of about 60 seconds. That's really a guideline. Anywhere from 1 to 5 minutes has been put out there in the research. But start with 1 minute and increase time as you feel comfortable with it. Again, should be mildly uncomfortable, but if you're experiencing pain, any sharp pain, numbness, tingling, any symptoms like that, stop and consult your healthcare practitioner. The next muscle group we're going to hit is the gluteals, which is really a group of 3 muscles. To start out, we're going to hit the gluteus medius, which is a hip abductor, which is a muscle on the side of the hip. As you can see, it's a similar position to the IT band, but the pelvis is rolled back a little bit. So instead of getting on the outside of the IT band, we're getting more of the muscle of the buttock. And we go back and forth over it. Probably going over it for about 30 seconds or so will be fine because it is a little bit smaller of a muscle group in terms of length. And then if we want to flip all the way over on the back, this will get more of the gluteus maximus where the hands are up in a bridge position. Heels can touch the ground intermittently for balance, but ideally you want most of the pressure through the buttock while you're doing this. If you wanted to advance this, you can move to the side of the foam roller, which we're not going to show here, but then you could do 1 at a time. Other variations are crossing the foot over the opposite knee and going down to the elbow if that's more comfortable for the patient. Any shoulder pain, any sharp shooting pain, numbness and tingling, make sure you stop and consult your healthcare practitioner.